Social Security, Medicare.
Yeah.
I have to say, I wasn't here around then.
Yeah.
But Supervisor, I'm sure the first pass on those pieces of legislation weren't perfect.
That's right.
And I'm sure that there have been adjustments to the Social Security Act throughout time. And so we are open to making sure that we tweak and make adjustments to this. Now, this is the last time you're going to hear us say Affordable Care Act or Obamacare, which I say affectionately. What we're going to say from this point forward is covered California.
Yeah, you're right. Covered California.
Because that's what we will hear here in California. Affordable Care Act passed at the federal level. The state has the job to put it into effect in California. We have the exchange board, and it's called Covered California. So that's what you have to tune into. When you're listening to the PR, the radio, TV, all of the information that you will see here today, and California's website, Covered California. We'll be honored in the next 15 minutes or so to hear briefly from Peter Lee, who was the director of Covered California. I'm so glad he chose to come to South LA today because it's important that he see you and you see him. And we're clear about who we're holding accountable to make sure that Covered California rolls out and is effective in California. Let me thank Alma Dawson, who is here providing translation services for us. Everybody tip your hat. Thank you, Alma. And let me say, I've had to transition to the Senate very recently. The state's a little slow with their budget, so we literally, my staff and I, don't have business cards. So don't think that we're trying to avoid you when we say, I don't have a card. We really don't. So let me have my staff raise their hand very quickly because I want you to know who they are. They're members of my team who work very hard every day. Ellen, stand up. Charles Stewart, we worked together for 25 years, and he staffs me on health issues. Joy is outside. So those are the people that you will see in the 26th district representing me, keeping their finger on the pulse of the community while I'm up in Sacramento with my boxing gloves on, Supervisor. So if you have pen and paper, I'm going to give you the new office phone number and the email address and the website. So you will have no reason to not reach out and have a conversation with us. The new office phone number is area code 213-745-6656. 745-6656. My email address, and I do answer them. Sometimes it's 3 o'clock in the morning, but I answer. It's senator.mitchell@senate.ca.gov. You wrote out Senate. It's S-E-N? It is Senate. So it's senator.mitchell@senate, S-E-N-A-T, the full word, .ca, as in California, .gov, as in government. The website is so long and convoluted, it's Google Holly J. Mitchell and you'll find the Senate website. That's the easiest thing to do. So if you're not online, you can call. If you're a techie, you can email and check out the website. As I said, Peter Lee is on his way from Paramount, and since he's from Northern California, he didn't really know how long that's going to take, but we do. So we're going to go ahead and get started with an incredible panel that we put together today to bring a panel of experts who are on the ground, again, making sure that we are operationalizing Covered California in a meaningful way in our community. And I'm going to ask the panel that if I'm going to introduce everybody at once and ask the panel knows they've got 5 minutes and they know that I'm a mean moderator, so I will give them the sign. And when Peter Lee comes in, I may just get someone to sign and we'll let you finish your presentation and have him come on after. I'm not going to ask you a test, but have you finish your presentation. Let me start with my far right, your far left, or next to right. Ms. Wright is going to talk about Covered California, the basics. She's the founder and executive director of the Green Foundation in Orange County, a statewide leader in fighting breast cancer, which partners with the California Black Health Network, one of Covered California's outreach contractors in LA. She's a certified outreach and education specialist for Covered California. Next, I'm very proud. Are you going to talk about our new partnership, Mariah? I'm very excited about something that we're partnering with SCIU in the Baldwin Crenshaw Mall, so I'll let him tell you the excitement. Araya Amoni, who is going to talk about the enrollment process and how to get help. Mr. Amoni was born and raised in Watts. His father is from Nigeria and his mother is from Mexico. He received a BA in economics from Berkeley. He's worked for the California State Legislature in the past, but currently he's the political coordinator for SCIU, United Long-Term Care Workers here in Los Angeles. Dr. Charles Lowe, who's going to talk about the Affordable Care Act from a physician's perspective. That's very important. Dr. Lowe is a retired OBGYN and participated in the birth process of at least 5,000 babies. He says, and I quote, "I want to be thoroughly used up when I die. The harder I work, the more I live." I think that's something we can all live by. He has served as Director of Infection Control at LA Metropolitan Medical Center and is a certified enrollment counselor. So these titles, enrollment assister, enrollment counselor, will mean more to you as they speak. Dr. Charles Hickey, who's going to talk about the electronic health records and the greater community. Mr. Hickey chairs my 26th District Community Health Cabinet. He makes me work very hard. He's the founder and executive director of Each One Teach One, which seeks to reform educational practices targeting at-risk youth. He also directs the Instructional Technology Systems Consultancy, which advises hospitals, clinics, and schools. He too is a certified outreach and education specialist and trains others in obtaining Covered California certification. And last but not least, Dr. Richard Allen Williams, MD, who's going to talk a little bit about healthcare disparities and Obamacare. He's a clinical professor of medicine at UCLA School of Medicine, founder of the Minority Health Institute, Inc., and the Association of Black Cardiologists. He's a former head of cardiology at the West Los Angeles VA Hospital. Please give the panel a round